Good morning, everyone. I am Justine Zillikin, Chief Strategy Officer for Sturdy Health, and welcome to this morning's Sturdy Health Clinician Conversation. And before we begin, I wanted to take a moment to talk a little bit about the slide that's on our screen right now. The best part of our conversations are the questions and answers shared between you and Dr. Terry. And there are two ways that you can participate in that conversation. One is by dropping your question within the YouTube chat function. And that's the first directive at the top, how to send a question via the live chat feature in YouTube. What's most important is to be able to chat via YouTube, you need to have a Gmail account and a YouTube channel. Really quick, really easy. As you can see here, your steps to log in, just kind of hover over the chat and see if you're able to place your comment. If not, you'll need to sign in, and it takes just a quick moment. It's really, really simple. We also love to invite you to join us here on stage. So if you would like to join us live and be on screen and ask your question of Dr. Terry, simply during the Q&A portion, we'll drop a link into the chat function and it will invite you to come on stage. We'll bring you on stage. You'll see Dr. Terry, myself, ask the question, and then we will send you back to your seat in the front row. So let's get started. Can't think of a better topic to talk about this time of year in coping with cancer during the holidays. And it's my privilege to welcome Dr. Christopher Terry. And I'd like to share a little bit about him. Dr. Christopher Terry is a hematology and oncology physician with Sturdy Health. He received his medical degree from Sidney Kimmel Medical College at Thomas Jefferson University, and he completed his residency training at Rhode Island Hospital with Brown University. Dr. Terry specializes in blood disorders and cancer, with a special interest in supportive oncology. And that really focuses on the care plan outside of your disease specific treatments. And it really helps to focus on improving the overall quality of life for the patient walking through their cancer journey. His love of sports led him to start an organization called Athletes Fighting Cancer to help grow the field of exercise oncology. And that is a field of study where the role of physical activity and exercise and what that plays in cancer care and how that helps with outcomes and just overall senses of well being. Sports also encouraged Dr. Terry to enter hematology oncology because he appreciated how it takes a care team to help patients and caregivers navigate the challenges that cancer can bring on both an emotional and physical level. Dr. Terry was born and raised in Clinton County, Pennsylvania, but has chosen, along with his family, to set down roots right here in New England with his wife, his twin children, and two dogs. So, without further ado, it's my privilege to pass the mic to Dr. Christopher Terry as he helps us to navigate coping with cancer during the holidays. Welcome, Dr. Terry.
Hi, thank you. Thank you for having me. Thank you for this opportunity. This is a lot of fun. It's a cool new platform, and really excited to participate in this and have this important conversation. And thank you for that really nice intro. It was very nice. I appreciate it.
My pleasure.
All right, so we'll have a brief presentation here where I'll kind of cover some of the things that I find come up frequently, questions that either come up in the office or that I've heard in speaking with others and support groups. And so we'll talk about coping with cancer during the holidays. Next slide, please. So, the cancer experience can affect all of us, and it can affect us all at different times in our lives and in different ways. So one of the things that I felt was important for this conversation was to be really inclusive and allow anybody who wants to attend because you may be someone who is going through cancer treatment after a recent diagnosis. You may have a friend or a family member who has been recently diagnosed or who is going through cancer treatments. Perhaps you are on the other side of your cancer treatments and you're now in the survivorship phase of your cancer experience, identifying yourself as a survivor or a thriver. And for others, maybe this will be the first holiday or first holiday season where you're remembering someone who has passed away from cancer. And you're grieving their loss and still trying to find ways to cope with not having them around during this special time of year, or trying to support family members as they continue to grieve. So all of these things warrant this conversation. And cancer is so complex that every individual, every experience with cancer is really, really unique. And so there's not going to be a one size fits all. And most of the things that I talk about, while they can be applied in a broad sense, may not apply to everyone and your specific need or question, or what you're going through currently. So it's really about understanding that this is a really complex disease. It causes a lot of complex emotions and challenges, and so you need to pick and find and choose what coping techniques and mechanisms work best for you. And those things may also change over time. So just trying to keep that in mind as we move forward. Certainly some of these recommendations or ideas or thoughts may not apply to you now, may never apply to you, or they may be kind of an ideal solution for you as you move forward. So keeping that open mind, but also knowing that everybody's experience is unique. And that's one of the things that I try to tell new patients that I meet, is that it's helpful to talk with others. It's helpful to get different perspectives, but ultimately your experience is unique to you. And so everybody's journey is a little bit different. But hopefully some of the things that we talk about today will be helpful. Next slide, please. So the holidays, comfort and joy. I'm guessing that if you're on this call or part of this discussion, you are not feeling some of the things that we put out there, or that we generally see associated with the holidays, which is all smiles, people gathering, having a great time, feeling wonderful, and giving lots of thanks, and just celebrating all the time. It's a very festive season, and depending on where you are in your cancer journey, whether you're going through treatments right now, whether you're feeling some sense of survivor's guilt, or having some persistent side effects from your treatment, or if you've recently lost someone, you may not be, what you're feeling emotionally, physically, may not align with what is kind of culturally what we're expected to feel at this point in time. So I just want to acknowledge that that's okay. And truthfully, many, many more people are probably feeling the same way you are feeling than you may realize. And so, of course, we want to have as many good times and maximize our moments and enjoy ourselves during this season. But it's okay to acknowledge that not everybody is feeling that way all throughout the season. And so we'll talk a little bit more about ways to try and have more positive, better times during the holidays. Next slide, please. So one of the things that also happens when you're diagnosed with cancer is you feel robbed of some of your independence or some of your ability to control things, especially in those early stages. That's often when it's really difficult, is you're kind of waiting for your next scan, or you're waiting for a biopsy result. You're waiting to understand what your treatment plan is going to be. And so that lack of control is often what's really difficult for people. And so right up front in cancer treatment, I try to emphasize to focus on what you can control. And I think that's a really, really important approach, and a useful approach to take as we enter the holiday season, is to kind of put on your thinking cap, or get your problem solving skills, and be proactive to control as many scenarios as possible. So a common thing is maybe you feel very comfortable and want to talk about your cancer experience, or where you are in your treatment, or the recent passing of a loved one, whatever your situation is. And so if you go into a group setting and you feel comfortable doing that, that's great. Maybe you would rather not have that be the focus of a holiday party or a gathering. And if that's the case, it's okay to make people there aware of that. So a couple of ways that you can do that. Sometimes people will actually draft a letter or an email or a text even to the group that they're going to be with, just acknowledging, hey, this is where I am in my life. I don't want this to be a key topic of conversation during our time together, and addressing it up front. and communicating that with loved ones and friends and family. Another another way is to actually kind of designate a bodyguard or a gatekeeper for yourself. So you have someone who kind of does that communication for you, someone that you trust, obviously somebody that you feel is on the same page, and respectfully goes and kind of addresses other people and lets them know that it's not something that is something, it's not something that you want to talk about at that time, and you'd rather focus your time and energy in other places and just enjoying your surroundings. So you trying to control the narrative and being proactive about that is really important in whatever situation you may be in. And if you can have somebody help you do that, that would be excellent. Anticipate problems. So obviously, this is kind of a similar process as to when we are prescribing your treatment plans. If we think that there may be some nausea, some diarrhea, any of these side effects, we'll often give additional medications to help address those side effects. And so if you're going to be going somewhere and you know that something may make you nauseous, or you want to proactively not be nauseous, you can take an anti-nausea medication before you attend an event or before you eat a certain type of food. It may also be helpful to find out what foods are going to be available if you're going to be going to a gathering. That may mean bringing your own type of food or beverage, and that's okay. But trying to anticipate potential side effects, problems, often simple things is knowing, like, where is a bathroom going to be, and as soon as you arrive to an event, going there, finding out where the bathroom is in case that's an issue, knowing if you're going to have a place to maybe get some space and rest if you need to. So just trying to think ahead, anticipate what problems may come up, and if you have concerns about a certain side effect or about a certain issue, it's okay to reach out to your healthcare team and ask for medications or recommendations to have available for whatever situation you may be in. If you're planning to travel, I think that's great, and I typically don't discourage anybody from traveling or spending time with their loved ones if it's a safe thing to do. If you're driving long distances or on a plane, making sure that you are safe in the car in terms of wearing a mask, or on the plane in terms of wearing a mask, and appropriate hygiene. Potentially making sure that you want to limit your risk of developing a blood clot with long travels by doing, sitting in the airplane and kind of pumping your foot up and down and doing some small exercises, or getting up to walk down the aisles. Simple things like that can be good preventative measures to making travel as safe as possible. But also make sure that you give yourself time to travel. Don't be rushing around. Don't add that extra level of stress to your holiday plans, and try to give yourself a little bit of a cushion when you're going to visit loved ones or traveling. I have heard of some people who, if they're going to visit family and they know of another healthcare provider in the area, it provided an extra sense of security and reassurance to have their family members reach out to a healthcare provider and kind of let them know that, oh, my loved one's coming here who is currently undergoing treatment with cancer. If there is anything that comes up, maybe trying to establish a game plan or a contact or some form of contact with somebody there. And then the other thing is, I would implore all of you to say no when you need to. Sometimes we tend to want to please everybody no matter what situation that we are in. I think it's important to set boundaries and have an understanding that this time of year you may not be able to do quite as much as you were the year prior, or you may not feel like it. And it's okay to say no and to advocate for yourself. And so turning down an invitation to a certain party, or saying no to somebody who may want to come to visit you. It's all okay, as long as you're kind of putting your best interests and your mental health, and making sure that your overall wellness is the priority. Next slide, please. So this is going to be a very, very common question for many of you. Is it safe for me to attend family gatherings? Is it safe for me to be around my grandchildren? In general, the I'm always going to kind of refer you to the bottom line, which is making sure that you talk to your healthcare team, because back to that first slide, everybody's experience is different and everybody's in a different situation. But in general, I would really encourage you to continue to get together with your family, as long as you're making sure that you're doing the right things by wearing a mask. If somebody's sick, especially, they should be wearing a mask. Obviously, the hand washing and just appropriate hygiene, having some extra Purell bottles around or hand sanitizer is really important. If you can get your vaccinations up to date prior to attending some of these local gatherings, anything that you can do to minimize your risk of getting an infection, maximize your ability to fight off infections is really important. I'm sure that all of you have heard a lot of these messages over and over again for the last 3 to 4 years. So it's really the same recommendations in terms of making sure that you're washing your hands. I would recommend wearing a mask if there's a big group of people, especially if there's people who are sick. If there are little ones who are sick, keeping some distance from them. So, watching them play together at a distance is okay, certainly okay. But also, I don't think that I think in general, a hug can be very therapeutic as well. So just trying to keep a realistic approach about all of this is important. Next slide, please. Traditions. I think this is a wonderful time to keep the traditions that you love, obviously. So if you love blasting Christmas music throughout your house and it's something that you want to do and it brings you joy, continue to do that. If you all wear matching pajamas, or maybe you don't yet and you want to get them, or you want to, I guess this family got their pets involved. Doing something a little bit fun or starting some new traditions, I think, is a really great thing around the holidays to do. I know that somebody recently started this gratitude box a couple of years ago, where they had family members all put in 2 to 3 things that they were grateful for. So I would encourage you to continue to hang on to those traditions that you love. Think about creating some new traditions. It's a good way to remember the holidays and have a fun time during the holidays. Next slide, please. So many of you may be asking, like, how can I help someone or how can I reach out to somebody who was recently diagnosed or lost someone? I really think, if we're doing a virtual event right now, live streaming through YouTube, which is pretty cool. There's so many ways to connect with each other. So obviously, if you're able to FaceTime or Zoom, it's one of those things, I think, that seems time consuming or difficult to set up, but if you take a little bit of time and are proactive about it, it's usually a lot of fun and people really enjoy hopping on and seeing each other, especially this time of year. So I would really recommend, setting that up and actually setting a time to make sure that you're doing that with your family. You can also make videos and send them to your loved ones. If you're not going to be able to be with each other physically, sending some videos is always a good way to stay connected. There's always the tried and true holiday card. I personally love those. I still love to send out cards to people, and I think handwritten notes is something that's always nice to see. It shows that somebody is really thinking about you and putting time into reconnecting. I have had a couple of patients who have actually developed like a happy memory box because there are times where they are feeling down, and they have found this to be a good resource or tool for them to raise their spirits and kind of bring back moments of joy for them when they are feeling down. They kind of reach for this box, and it's filled with either different photos, cards, mementos, tickets from something that they attended, anything really that brings back positive memories and stimulates your brain to release some of those positive neurotransmitters and elicit some better happy emotions. So having something like that on hand may sound a little cheesy, but I guarantee you it will work. And if you so either making that for somebody or you making it for yourself, I think is a great idea. And then getting outside, getting some fresh air, going for a walk, kind of in solitude. This is a time of year where a lot of people are reflecting on what's gone on over the past year, and chances are, if you're on this call, you've gone through something really challenging and potentially traumatic, and you're still finding ways to cope with it. So being outside, fresh air, going for a nature walk alone or with your family can really be therapeutic in many ways. And so I would encourage you to consider, several of these options in terms of trying to stay engaged with others and enjoy the holiday season. If you want to pick up the phone and check in with a friend, call them. I always encourage people to have, before you call, kind of think of one positive memory or one thing that you want to tell that person you're grateful for or thankful for about having them in your life, to add an additional kind of happy tone to the call, but also understand it's okay to allow to provide space for some of the more challenging, difficult emotions as well. And we'll talk a little bit more about that here in some upcoming slides. Next slide, please. As you've probably gathered, a lot of this comes back to kind of our overall mental health. And so one of the things, back to, being proactive and making sure that you have medications available for certain side effects. If you are on certain medications for your mental health, make sure that you have refills, or that you maybe you need a dose adjustment or something like that during this time, or maybe you need to be started on a medication. But as sometimes pharmacies have kind of crazy hours this time of year, it's nice to make sure that you are prepared and have the medications that you need and don't get stuck in a tough position as pharmacies, offices, whatever, may be closed or have limited hours. If you have a therapist or a counselor, maybe connecting with them prior to the holidays and coming up with coping strategies. Or connecting with your faith community is really, really important, and I think is a wonderful way to stay engaged and have a community around you during the holiday season. There are lots of support groups for cancer survivors, for individuals going through cancer, for specific cancer types or diagnoses. So, we do offer some of them at Sturdy Health, which have been wonderful. And I would encourage you to reach out to other support groups, look at the professional organizations or nonprofit organizations that offer them. But getting another way to really have a community is really important. I think it's a great idea to have 2 to 3 people that you can call at any time, and you kind of make that clear to them. Say, hey, you're going to be one of my go-to people that when I'm feeling down or if I need something, I'm going to give you a ring and call you. And knowing that you have those people that you can rely on and that you can call at any time is really helpful. And communicating that with them is also helpful. I think sometimes we think that that's not something that we need to communicate. But not only sharing, if you share that with someone, it empowers them and it makes them feel, it identifies a role that they are playing in your care and in your overall well-being. And so it may make them more receptive to receiving calls. They know what to expect and how they can support you by letting them know that they're one of your people that they want to reach out to. Or that you may want to reach out to. So I always encourage people to have 1 or 2, at least potentially up to 3 people to call at any point. And then the other thing that I would say is consider looking into different either like meditation apps on your phone, or meditation programs online. There are lots of different ways to kind of practice meditation or mindfulness. And this is really, a lot of people who practice this really find it beneficial. I was someone who was very skeptical about the utility of meditation and mindfulness, but tried to introduce it into my life through some of these apps. And I've hopped around on different apps, and they're all great and have their strengths. And there are usually some free trials with them, especially around during the holidays. But just having some direction, whether that's some music playing in the background or it's an actual guided meditation, finding ways that you can help your body relax, finding ways that you can practice some deep breathing is really, really powerful. And I think it's a simple tool and method that we could utilize a lot more to help ourselves. And I know it certainly comes in handy this time of year. It can be helpful for sleep. It can be helpful for stress, for decompressing, for reflection, for gratitude, for a lot of different things. And so I would really encourage you to look for some different apps or resources to explore some mindfulness, meditation, deep breathing exercises. One other thing that I didn't put on here is journaling. I think journaling is very powerful also. We said controlling the narrative up front. So being able to write things down, write out your emotions, it's sometimes a safer place for people to feel like they can express themselves. There are lots of wonderful journaling communities. The isolation journals is one that I am particularly a big fan of and think is wonderful, where they give you different prompts to write about. And it was started by a woman named Suleika Jawad, who has leukemia again for the second time now. But she's developed a really wonderful journaling community. And I think obviously that's not the only one, but if that's an effective way for you to express yourself and to share your emotions, either keeping them to yourself or sharing them with others, it's definitely something that can be helpful and is worth exploring. Next slide, please. All right, emotions. I think there's a lot of power and strength demonstrated in vulnerability. Emotions can creep up on us and come at us at different times, and I think it's important to kind of embrace them. Often you can't control what you're feeling in a certain moment. There's something that's triggering, and that can be, I've talked a lot about gratitude and kind of joy and happiness. And you may be thinking at this point, man, I am not grateful for the situation I am in at all, which I understand. So it's okay to embrace any of these emotions: anger, frustration, grief, anything that you're feeling. You need to make room for all of them, validate them, and just know that it's okay to have these emotions. One of the things that I always have found interesting is how people apologize once they start crying or start to show what their true emotions are. I would encourage you not to do that and just kind of embrace it and let your feelings be known. And it's the kind of things that we teach our children, but for some reason we forget as we get older, that it's okay to have these different emotions, and we need to learn how to deal with them and cope with them and validate them. So in this same vein, sometimes I think embracing certain moments and really soaking in certain moments, sometimes whether it's just holding somebody's hand or giving them a hug, and you notice there's this sense that it's an extra special moment or an intimate moment, really soaking that in, embracing it, trying to make a permanent memory in your mind, make space for a permanent memory in your mind is really special. And I think that the holidays tend to bring out some of these moments, and I would encourage all of you to look for them, try to be aware of them, and then embrace them and sit in them as long as you can, and make some positive memories from them. Okay, next slide. Many of you may be heading into the holiday season for the first time without someone who is normally with you, whether that's your spouse or your father, mother, child, whatever it may be. And I think it's important to acknowledge that grief is present, acknowledge that person was in your life. And so back to the traditions that I mentioned previously, it may be a great time to introduce some kind of new tradition. Sometimes people like to, play a record of someone, or a record that somebody had of their favorite song, and just take a moment to listen to that as a family or as a friend or individually, and to remember someone. Maybe creating a small memento box, or raising a toast to somebody, photos. All of these things can be really powerful. But I think that the key here is not to run away from it. I had a friend write me something. She said she lost her husband recently. She's in her mid 40s, and she said, acknowledging that my husband is missing has really helped me. She said, it's sad, but it's real. And acknowledgement lets those who are grieving know that you haven't forgotten. They are welcome to talk about it if they want, and create space to talk about how hard it has been. Letting someone do that without trying to cheer me up or fix it was the best gift that I was given. So again, I think there's some power in grief. Grief is something that is not easy to is unavoidable, and it comes at any time, and it can come unexpectedly. So finding creative ways to remember people that you love, honor people that you love who may no longer be with you, can be a very powerful and therapeutic tool for not only for yourself, but for others. And so opening that space, I think, is really, really important. Next slide. I think that covers most of the presentation that I wanted to talk about. I know that there's probably lots of additional questions, so I'll hand it back over to Justine.
There we go. Dr. Terry, I was just looking at the stream of questions that we have coming in for you. Before we move on to that, I just want to say thank you. I think thank you for acknowledging and giving permission to, it's okay not to be okay. That, I think when you chose your topic of coping with cancer for the holidays or during the holidays, you could have simply stopped at coping. This is a difficult time of year, and just having these tools and being given the permission to say it's okay to feel what you feel really resonates. And so before I dive into the questions that have been streaming through, I just want to remind our guests with us today that if you would like to join Dr. Terry on camera and ask your question personally, please check the chat box. We've dropped a link in there to bring you on camera. And once you ask your question, we'll send you backstage, and you'll still be able to watch and listen to the conversation as it continues on today. If you prefer not to be on camera, absolutely no problem. Just continue to do what you're doing. And that's drop your questions into the chat, and I will share them on your behalf with Dr. Terry. So Dr. Terry, let's dive in.
All right, let's do this.
Let's do it. Our first question is, again, about the exposure. Should I not attend gatherings, because of my health situation, or remind us what we should do to keep our health top of mind?
Yeah, and obviously that's going to be an ongoing question. It's been a question that we've been having a difficult time with over the last 3 to 4 years. So, and we are seeing a little bit of a resurgence of COVID-19 right now. So I think it's important to acknowledge that and keep that in mind. I do recommend that patients of mine stay up to date with vaccines the best that they can, and we provide guidance for that. So I would certainly recommend talking to your healthcare provider about whether or not you're eligible or it would be appropriate for you to receive those vaccines. And then in terms of planning ahead is really having an understanding of who's going to be there. And a lot of it comes down to your own comfort level and what, and your specific disease and where you are in your treatment. I would encourage everybody to, just be mindful that everyone has different preferences in terms of their exposures. If you are sick, if you're feeling sick, if you're having symptoms, please wear a mask to help protect others who are there. And then when you are attending somewhere, if you have concerns that others there may be sick, I would recommend that you wear a mask as well. It's crazy how effective hand washing is and how we tend to forget it so quickly. Even myself as a physician, and I preach this all the time, I'm sure that I could do a better job with just being aware and cognizant and making sure that I'm washing my hands before and after handling food or meeting people. So I still think that there's more benefit and therapy in being with loved ones and being, surrounded by people that you love. And like I said, maybe getting that hug from your grandkid or your loved one that you haven't seen in a while. I think that's so powerful. And I would hate to tell somebody not to do that. I just ask that you then be proactive about being safe about it as you enter those different types of settings.
Dr. Terry, I think that's a wonderful reminder for all of us as well as, not just to wear your own mask to protect yourself, but also feel comfortable asking someone else to wear a mask. We're more than happy to, I think in social settings, definitely in our professional setting, but even in social settings, people don't mind if you ask them to wear a mask to help protect you as well as themselves. And I think
Yeah.
all of us can agree that Purell is the perfume of choice during the holiday season. So again, hand sanitize, hand sanitize, hand sanitize.
Yeah.
But Dr. Terry, you had talked about really controlling the narrative. And I thought that was very powerful because it seems through the questions that we have coming through, it really is how do you begin that conversation? And one of our guests with us today asked the question of how can I shift the conversation to something other than my cancer or the status of my treatment?
Yeah, that's a great question. I think it's a major challenge for a lot of people for multiple reasons. One, because the people who are asking typically really care and want to genuinely know, and that's wonderful. And it's a way of them expressing that they love you and they care about where you are in your current situation. Having said that, it's also okay to kind of to try and set some boundaries. I encourage people to kind of have a line in their pocket and ready to teach back, so to speak, to people that come to talk to them. So saying, I really appreciate you asking about where I am in my disease or my treatment, but I really would love to focus on being here with family and not on my disease right now. So I would just try and kind of come up with a good line that you can almost have scripted to tell people. If you're hosting, maybe trying to make it clear up front that just give a blanket statement kind of to your guests that are coming. So then they're all on the same page and they all know. If somebody else is hosting, ask them to share that message to the people who are coming, as long as you feel comfortable with that. So
That's a great point because I think, there's anxiety on both sides. We tend
right.
to overcompensate by either asking too many questions sometimes so that people know we care, or, in the example that your friend shared, sometimes not ask anything so we don't get anybody upset. So it's wonderful to kind of, again, as you were saying in your presentation, control the narrative and
Yeah.
help proactively share that. And I love the idea of having something in your back pocket ready to go. Now,
Yeah.
my favorite subject has come up, Dr. Terry, and that is food and beverage.
Oh
So
yeah.
I have two questions for you. The first is, can I have just one alcoholic drink during the party?
Great question. I'm so glad somebody asked that. And I'm sorry that I didn't cover that in my presentation because it is definitely a common question. So I will admit that, as somebody who has really started to put a lot of focus and energy into the research behind, the lifestyle that we live and how that affects our not only cancer treatment, but cancer prevention and survivorship, there's more and more evidence coming out that alcohol actually does play a negative role in the cancer experience overall. So I have definitely shifted my recommendations from saying just keep it in moderation and be smart about things to trying to avoid alcohol as much as possible. Having said that, I think in most cases, a glass of wine or one alcoholic beverage is going to be okay. Again, it's something that you should talk to your healthcare provider about because if you are on some specific treatments, there could be additional risks associated with it. But I think it's always comes down to kind of just being aware of the the situation that you're in with your treatment, and doing things in moderation. It's crazy now. There are so many non-alcoholic beverages that taste just as good as the alcoholic ones. So there's tons of different mocktails and
Mhm.
non-alcoholic beer and seltzers and everything. So I would encourage people to maybe dive into that a little bit more. Having said that, admittedly, I will probably have one alcoholic beverage on Christmas or something like that as well. And I think it's just trying to be smart about it is what I would recommend. But in general, I think it's safe to have one.
One, too, like you said, now the mocktails are incredible. So lots of options. If you want to, again, choose that drink, enjoy it. But again, all things in moderation. And I like what you're reminding us of also is to be proactive and speak with our care providers ahead of time for those prescription refills, the do's and don'ts, just so that we make sure that we continue to have a merry and bright holiday.
Yeah, absolutely. I think having checking in with your care team provider if you're going to be going to certain events or traveling or anything like that is really important during this time of year, making sure that you're all on the same page.
Perfect. Well, and my close second favorite topic, food. And the question that comes in is, what types of food do I need to avoid if I'm on chemotherapy, especially when everyone is pushing everything right at you to enjoy?
Yeah, I think that we probably do an entire other presentation on food, on how wonderful it is, all the options. So one thing that I didn't really talk a whole lot about is like emotional eating at this time of year, because we did talk about emotions, but sometimes we cope with our emotions in different ways, and that can be sometimes dealt with food. And so we find ourselves picking and eating at food more so than we normally would. So trying to have some idea of limitations in terms of how much you're going to have of something, again, in moderation is important, and just kind of acknowledging that and having the awareness. I certainly encourage that. In terms of foods to avoid with chemotherapy or with treatment, if your white blood cells are really low, and a specific type of white blood cell called your neutrophils, we call that neutropenia, you are often at increased risk for certain types of infections. And historically, we used to ask people to stay away from like fresh fruits or vegetables that maybe had not been washed. That actually, there's not as much evidence for that anymore. We may have been overdoing it. So in general, the foods that I would recommend avoiding are probably really heavy, greasy foods, because your stomach is going through a lot of changes when you're on chemotherapy and may not be tolerating that too well. So hopefully, if you've been going through treatment, you've kind of gotten an idea of what sits well, what doesn't sit well. But I would definitely avoid some of those heavier foods, some of the greasy foods, and really just trying to. The other thing that I think is important too, as like a caregiver, we often show or express love by wanting to feed people. And
my family.
Most families, so many families that I meet, it's like, it's natural to want your loved one to eat and to drink and to stay hydrated and all of those things. And that's certainly important. Hydration is really important. At the same time, if somebody's body is telling them that they shouldn't be eating something, especially if they're going through treatment or they have an underlying disease, then don't take that as an insult or a sign of disrespect. Respect that for them, and respect your body and listen to your body, because there may be a reason that you're not, as eager as you normally would be to finish that meal or to have that dessert. And so kind of respecting that both as an individual for yourself, but also as a family member who loves to cook things or bake things and give them to your loved ones. Just know that, that may be something that's a little bit different this time around, this holiday season.
Excellent. And Dr. Terry, we actually have someone who wants to join us on stage and ask a question before we move on to our mail-ins. So thank you for joining us this afternoon. I understand you have a question for Dr. Terry.
Hi, thanks, Dr. Terry. First, thanks for all the information, because this is really great and I appreciate the tips. I was wondering if you have any advice on how I can deal with family and friends if I don't feel like celebrating, but they just don't understand.
Yeah, it's really difficult. Yeah, it's a great question. And thanks for being part of this. This has been a lot of fun. And that's a really difficult thing. And that's a common question that I'll get in the office as well. And I think part of it is setting expectations beforehand. And honestly, I would encourage you to put it on your healthcare provider, put it on me, put it on your doctor, put it on your healthcare team. Say, my doctor, and I think that's an okay excuse for a lot of different things. If you need, I feel so lucky that my mom and dad used to do that. Like if I didn't want to feel comfortable in a certain situation, you can always blame us. So same kind of thing, same kind of scenario. I would say if there's a certain situation where you don't feel like you're going to feel comfortable attending, but you also don't feel comfortable expressing that as your own personal decision, just let them know that it's a bigger issue from your healthcare team and concerns there. And communicating that up front, setting expectations, setting boundaries up front, I think is important. So if you are attending somewhere saying, I'm going to come, I don't know how I'm going to feel that day. I hope that I can really enjoy being around everyone. But, if I'm not feeling like my normal self or I need some space, please don't take it personally. So again, I think a lot of it's just about being proactive and communicating. And then if you can get some of those, take the medications or things like that can help, pre-medications to help you feel as good as possible prior to those events. That's great.
Thank you.
Yeah, you're welcome. You're welcome.
I think that's so helpful. And thank you so much for joining us on stage. I think that's so helpful. And it really is resonating with the communication. Let's make sure that we're communicating and sharing both ways so that everyone can enjoy whatever the experience is meant to be. And now, Dr. Terry, I have 3 more questions that have come through. So I'll start with the first question. What strategies do you suggest to manage the stresses of a family member going through this process when they are the person that brings the family together during the holidays?
That's a great question, and something that I've seen commonly. I would encourage people to be proactive about it, meaning I think I've said that answer like to basically every question that I've gotten now that I realize that. But I would encourage like loved ones to try and take on those responsibilities and almost ask for forgiveness later. I know that sounds maybe a little aggressive, but I think often if you take that initial step and you let the individual know that you enjoy doing this for them, it's empowering to you, kind of taking it off of their plate, letting them know that this is something that you want to do and it makes you feel good, to take on a responsibility that they typically would do for your family, whether that's hosting, cooking, getting certain gifts. I do think that in general, sometimes I'll hear a lot from people who will say they don't really like hearing from, although it's with the best intention, how can I help? It's better just to help. And like I said, it kind of asks for forgiveness later. And again, letting the person know this, I'm doing this because you've done this for so long and I want to do this. It's not a burden. It's actually empowering to me. And it means a lot to me to be able to do this. It's a privilege to do this. So I would encourage you to be proactive in those situations, and try to take off some of the responsibility for that individual so that they can really enjoy their time with others, and relax and save their energy for the interactions. I will say, I will say one caveat, which is you don't want to rob them the individual totally of their independence and what they like to do. So for some people, cooking is therapeutic. So maybe trying to find limit the number of tasks that individual has, but then also proactively offloading some of the responsibility. So it's obviously unique to every family, every situation, but I would argue that a balance of that would be the approach that I would recommend for most people.
That's great advice. Now, this is a great question. I didn't even think about this. And that's why we have wonderful guests with us this morning. Should we make the airline aware of our condition during or prior to traveling?
That's a great question. I think it probably depends on what the condition is. If you if there is something that in terms of transportation to and from terminals and things like that, from a ambulatory or mobility standpoint, certainly trying to be proactive about that and trying to make sure that you have help and assistance to get around would be helpful. if you're immunocompromised, meaning that your immune system is being affected by your chemotherapy and your treatment, truthfully, I don't know what the airline would change a whole lot. I don't think they're going to be able to enforce that everybody wears a mask or something like that. It may be reasonable to talk to the when you're getting seated, or the people at the gate, in case there is some flexibility for seating to be around either family or be in a certain area where maybe your exposure limitations would be limited. Similarly, you could ask for an aisle seat so that you can walk up and down the aisle if you need some mobility there. Or if you are concerned about nausea, diarrhea, things like that, asking if you can get as close to the bathroom as possible. So I think in certain situations, it may make sense to speak with somebody about where you would be sitting.
That's a great point, Dr. Terry. And I think it's also thinking about our flight attendants or the cabin stewards, to let them know so that they can make sure that proximally you're in the right place and that you can be as comfortable as possible. Dr. Terry, what if embracing therapy, talking to your partner or friend doesn't feel as, inviting, or you don't really feel like doing that during the holidays? How can you help navigate those situations with people during the holidays, and maybe with the person, our guest? I think about, if you come from a family of huggers or friends that are huggers, but I really don't kind of feel like being hugged right now. How would we manage those types of things if it's really doesn't feel right now? And I hope
I'm a hugger.
If I didn't, please drop it back in the chat.
Yeah, it's a tough one. I think that in a lot of these situations, trying to be creative is helpful. So if you don't want to hug someone, again, making that clear up front, but then maybe come up with some kind of other sign of expression, or way to express that you care about each other, that you love each other. Whether that, for at COVID, a lot of times people were doing this like elbow thing. And that's not really my thing, but if that's what you want to adopt and you want to do that, and that's going to be your way of, kind of expressing love and showing that you appreciate them being around, you appreciate them in your presence, that's great. So I have a patient who, with her daughter, she'll put up one, she'll do this, and then her daughter will come over and do the other side of the heart, which I have kind of stolen and now do with my daughter because I think it's adorable. So, coming up with creative ways, because it does two things. One, it makes it clear that you're not comfortable with that at this time, or that you're just not in a place where your normal displays of affection is where you're at currently. So it makes that very clear. And then two, it shows them that you still love them and that you still want to express some appreciation for them and who they are and what they're doing. So that's what I would recommend from like a physical standpoint. From a emotional standpoint, I think it's totally okay to tell people that you don't want to talk about something, or that you don't feel that that it's something that you want to share right now. And if you're not getting the response that you want from someone, let's say you're trying to talk about it with someone, you can ask them, you can say, that's important for me to talk to you about this. Why is it difficult for you to talk about this? So you can try to explore what the barriers there are. I think that's a useful tool also. And then I also always tell people this, sometimes the best thing you can do is actually just sit in silence with each other. Silence is really, really powerful. You don't always have to fill every period with words, just to make it less uncomfortable for you. Sometimes just being present with someone and allowing the silence, allowing the space is really, really powerful and really helpful for individuals. So that's okay too. And I think that you should be open to that, both as a caregiver and as someone who is dealing with cancer right now.
Dr. Terry, I think that is so profound, because I think being comfortable with the silence, and also the tools that you gave us throughout the conversation, is having those other outlets, that maybe you don't feel like talking or sharing, but you can journal, or you can
Yeah.
meditate, or take a quiet moment. Dr. Terry, in this last moment we have, I'd like to ask you, what are some ways that we can leverage some exercise in a way to help us cope during the holidays? It doesn't create any more stress.
Oh, I love that you asked that, and I didn't even plant that question. You just brought it up. So, I mean, exercise is obviously is such a powerful tool, and it's something that I really didn't talk a whole lot about with the holiday season, but it's very important during this time. I did mention, getting outside and maybe trying to do like a nature walk or something like that. But if you're not able to get outside, or it's too cold, or whatever the case may be, simple things in and around the house can be really useful. I've always said to people, even just coming up with a small goal of like walking around your table 5 times and making it a small, manageable goal. One, if you're able, after you do it, you have this sense of accomplishment. So mentally, it's very helpful. It's good for your body, obviously, to kind of get the blood flowing, get activating some muscles. There's lots of different programs that you can use online, or even on TV through yoga and some like guided exercises. So there's lots of opportunities to do that. But I would say set small, manageable goals, and also find something that you love. If there is a type of activity or exercise that you love, stick with it and utilize it as much as you can. But certainly, yes, being active, exercise. If you can do it as a family or with other people, it's an amazing way to again develop a community and to bond with others. So thank you so much for asking that. And there's lots of excellent ways to incorporate that into the holiday season too. I know people do the turkey trot thing after Thanksgiving, and there's lots of runs out on like New Year's Day. I forget what they call it, but all of those like 5Ks and stuff like that. All of those things are great, and if you can do it with family, even better.
That's fantastic. And what a great way to engage the little ones, even just walking around, walking over to the Christmas tree, and just, enjoying those moments as well. Dr. Terry, I can't thank you enough. This has been incredible. And I think the takeaway for all of us, really, and those that may be coping with cancer around this time of year, as well as those who love and care for someone who's coping with cancer during the holidays, is really everything that you've told us. Be proactive, put a little more thought in to our planning. It's okay to not be okay, and it's okay to say that. It's okay to say no. And do what you can, and just enjoy and be grateful for those moments. So, Dr. Terry, before we wrap up, I would love to share some information on how our guests can reach out to you after the program today. So again, for the Sturdy Health Clinician Conversations, we're so grateful for you, Dr. Terry, in helping us cope with cancer during the holidays. And if any of you in the audience have additional questions, feel free to contact Dr. Terry. This is Dr. Terry's email address at C, as in Christopher, Terry, all one word, at sturdyhealth.org. And please follow us. We are Sturdy Health on Instagram. We are Sturdy Health on Facebook. We are at Sturdy Health on LinkedIn and YouTube. Of course, you found our channel, and we are also on Threads. So again, may there be joy, health, and wellness in your holidays. Dr. Terry, to you and yours, have a wonderful holiday season.
Thank you so much. Thanks for doing this. This was awesome.